The coronavirus has impacted us as an organization and as a home here in Honduras in so many different ways. Just here on the ground, one big thing is of course the change in human interactions and how we say hello to one another, and you know, things like giving a high five or giving a hug to a child, and all of these things that you just can't do anymore. And they're not without their psychological impacts, and no child likes being told step back and stand back, and it creates this weird barrier. And even though we're trying to create and invent new ways of demonstrating affection and our love and care for one another, these things are not easy and always a challenge. Our kids have not been able to go out and see their families. NPH has always tried so hard to cultivate the family ties between our kids and their biological family outside, and even though a lot of the time that's a very difficult job to do, we try it, and we put a priority on it because it's important. Many of our kids look forward to the Easter time when they have the school vacations and they can go out and see their family, and of course during this time that's impossible. And so the phone calls and all of that, like I mentioned, the video conference has helped a lot, but it's still a huge challenge for our children not being able to see their family during this time. Stepping back on a more, I guess, international level, organizational level, economically there's of course been a huge hit. The fundraising offices don't have an easy time of doing their job during crisis periods, because of course when there is an economic recession, like there most likely will be in many countries, that has an impact on being able to find money. Here in Honduras, we're spending more because of the virus. We're having to, over the last 2 months we've spent nearly $10,000 on medical supplies and materials, disinfectant, masks, the hand sanitizer, as well as $4,000 extra each month on food because of prices having gone up. And these things have added up and will continue to add up, and in times of crisis when it's more difficult to find funds and costs are also higher, that creates a huge challenge. In terms of our local fundraising that we try to do here, we've already lost, or we've not received 75% of our local sponsors who have been with us over the years. They've just told us that they've not been able to make the transfers for this month, and they have to wait to see how the situation develops. So all of these things are hugely impactful for how we operate and what we can do here. And so, yeah, that's a bit about the impact. With our elderly folk, our abuelos, our grandparents that live in Casa Eva, as well as our children with disabilities, we are making sure to take extra care and extra caution in how we manage that situation. Of course, it's a population that's extremely delicate and extremely vulnerable, and so we're not taking any chances, and we're being very cautious and making sure that there's no one from even any of the other hogares going to visit those homes. We don't have anyone in those buildings that don't absolutely have to be there. So in the case of the children with disabilities, it's really just the childcare staff that are allowed in. In the case of Casa Eva, for the elderly folk there, it's also just our staff in charge of that area, as well as the university students who help out. Those university students have a separate area where they live. Also the staff, when they're on their break time, they can't interact with any of the other people here on the ranch because they know that they're going to be going back to that specific area. So that's also difficult for our university students especially. who, their friends are here, their brothers and sisters are here, but because of the fact that they work in that area, they can't have any interactions with them even when they're on break. And the staff also, they can't have any interactions with the other staff even when they're on break. And that's been quite a challenge. It's also quite difficult for the kids themselves that are in those hogares, because you walk past them every day and you wave in and they're saying hello to you and everything like that, but you can't go in, you can't get close. It's difficult for our kids, especially the kids in Casa Suyapa, who are so used to going to visit the elderly folk in Casa Eva, and they enjoy it. They always have enjoyed it. They would go and have activities there with the elderly folk, and the elderly folk have always loved that. And because of this situation, of course, that has had to stop. So yeah, the protection place is really just that sort of extra level of quarantine, as well as the basic level of quarantine that I mentioned in the video conference, which is when there's a staff turnover, for example, they'll go through the same quarantine of 2 weeks 10 days in the quarantine area that we have set up, as well as 5 days previous to when they arrive here, where our healthcare staff will be calling them and making sure that they've been following the preventative measures and not leaving their house and washing their hands and all of those sort of things. In the event that the coronavirus were to come to the ranch, we have already taken a lot of steps to make sure that we're prepared, and that includes the purchase of many of the medications that they're using to treat the symptoms of the virus. It includes making sure that we have a quarantine area set up, and right from the beginning of all of this, we had gone down to the Mascati Center, which is generally visitor accommodation for the medical brigades that come down. It's a very large building, so that would function quite well as a quarantine space. At the moment, like I mentioned, it's being used as a quarantine space for the incoming shifts, the incoming staff. But if we were to have a COVID positive case here, we would have to find other places for those incoming staff, other quarantine areas, and dedicate that area specifically for people who are coronavirus positive. We have already taken measures to make sure that Mascati Center is set up for that. We covered one space off with a huge plastic kind of tarp, which blocks off that area. We put plastic sheets covering the beds, so that if we were to have a case, we could then just change the sheets as opposed to the mattress getting also infected. I mentioned in the call we're trying to find to see if there's a way to get testing down here from the States. That's a work in progress, and we're hoping that something can come of that. Dr. Merlin Antunes, who's a hermano mayor who grew up here in the ranch, he's been working on that through One World Surgery, one of their partner organizations of NPH here in Honduras. And so those are some of the measures. We know that if we were to find a coronavirus positive case here, we would need someone to take care of those people, and so people have said that they would be willing to do that if we got to that stage, and that's something that we'll have to figure out also. We do have a certain number of N95 masks and protective equipment, the full body suits, but not that many, and so we're trying to figure out what we can do if there's a way to get more of those materials, but that's a big challenge as well. I'd just like to tack on to the end of that clip, that question on the plans that we have in place for what we would do if the coronavirus were to get to the ranch, to say that thanks be to God we don't have any cases of the coronavirus here as yet, not amongst our children, not amongst our staff. Obviously we're taking all of the measures that I've mentioned in the other videos and in the video conference, so we're hoping and praying that we continue like that. But yeah, we do not have any cases at the moment. The security situation on the ranch is good at the moment. We're lucky enough to have 16 members of the security team that are very dedicated, very hardworking. We have a very talented leader of the security team, Victor Funes, who's been doing an amazing job in organizing them and making sure that they are following protocols and they understand what's going on and what the risks are. They are actually one of our only population that are coming in and going out of the ranch every day, as opposed to doing the longer shifts with the quarantine, just because of the fact that they don't go near, and they've received the instructions that they shouldn't go near any of the internal population here. They maintain their distance and they don't touch any of the surfaces and things like that. So Victor's been very good in giving them sort of awareness talks and coordinating that also with the health department. The situation may get worse. We're making sure that we're keeping vigilant and keeping an ear to the ground on these things, because of course outside there has been reports of looting, there has been protests and things like that, and people are of course hungry. A lot of people don't have access to food and medications, and so that stress and anxiety does rise and may continue to do so as the number of statistics of the cases go up. So we are very aware of it, conscious of it, and doing our best to make sure that all the protocols are being followed here. In recent weeks, no, we haven't had any kids come to the ranch, any new kids come to the ranch. However, in Catacamas, in Casa Mi Esperanza, House of My Hope, which is our transition home in Catacamas, which is a different state, a different department called Rancho. It's about 3 hours from here. There we do continue receiving cases from time to time. But that is a transition home. It's a little bit different in the way that we operate, in that the function of the transition home is to receive cases of children who are at risk, who have been removed from their families by the government for the same reason, because they're at risk, whether it's abuse or abandonment or whatever the case may be. Our team in Catacamas, in that program, is all about going out and looking for other family members that could take care of those children, so that really it is avoided that they have to come to an institution or a home for a long period of time and be separated from family for a long period of time. That's something that we believe quite strongly in. When a family is the right option for the child, they should be with them. And so they have been receiving cases, and what they've done to make sure that they're taking all precautions necessary is that they have also set up a second home. We're renting another home nearby, which is acting as a quarantine space for all of the kids who are coming into the center, into the program, which means that those kids stay there for anywhere from 10 to 14 days, as well as the staff who are on the incoming shift, let's say. They'll go through that quarantine program first. And so in that way, we're protecting the kids that are already in the program, as well as protecting the staff that are working in that program, Casa Mi Esperanza. Yeah, we have considered stockpiling medications. We have actually been, we were looking at that about 2 or 3 weeks ago, because we were finding some difficulties in access to medications from some of the drug distributors in the north that we buy from. The reason is, up north the coronavirus situation is a lot worse. and so it was difficult to buy from those distributors, and so we were having to buy from some of the local pharmacies, which of course means inflated prices. Um, so when we could, and phoning all of the different distributors that we work with and have contacts with, we were able to make a purchase for permanent medications that some of the kids or youth or children with disabilities here take for 3 to 4 months. So we have that stockpiled, and we will continue making those phone calls and continue stockpiling so that we don't at any point get left short. If we do start to see that it really is difficult, the access to medications, the next step would be something that we were looking at that time also, to see if it reduced costs, which would be purchasing those medications in the States and getting them shipped down. Whether we do that through a container or whether we do that through another shipment was something that we were looking into. At the moment, we still have access to medications, and we can manage the situation. But further along, if it were to get worse, that's also something that we'd have to consider. Up until now, we've been able to purchase face masks and certain PPE. We don't have the number that we would like, especially the N95 masks has been quite difficult to get our hands on. So we're restricting the usage of those masks just for the nursing staff. For example, if they have to leave and go to Tegucigalpa for any reason, an emergency or anything else, they'll wear those masks. Our drivers, if they have to leave, will also wear those masks. But yeah, it's really not easy to get our hands on them. So those things, that has been difficult. We have some of the full body suits, but if we were to have a coronavirus positive case here in the ranch, those things would also, those materials would also be quite difficult to obtain, and so that's some of the issues. What we're trying to look into at the moment, like I mentioned, is bringing down a container from the States, and One World Surgery is coordinating that and helping out a huge amount with that. And so on that container, we're hoping to bring down more supplies also. So that should help. Yeah, we do still have 2 volunteers that are here on the ranch that have chosen to stay. That is Hester, who is a physical therapist from Holland, and Gusnada, who is a occupational therapist from Chile. The 2 of them have been doing a wonderful job here from the beginning throughout all of this, and have gone so far beyond the call of their professional field. They've been really in everything. For a while at the beginning, they were working with the health department on, and still are actually, doing temperature tests with the temperature sensor. We do that with all of the everyone that's here on the ranch, over 500 people, including children and staff and university kids and high school kids, youth. And so they've been helping out with that. We're doing it all day at the beginning, and now they're just doing it in the mornings, and in the afternoons they're working, starting this new project, which is all about helping the children who have siblings in other areas, like the boys who have a sister in Toledo Kumi, for example, where we have started this program so that they have this socially distanced activity, and they run that 3 times a week, and they will generally run it with around 2 to 5, anywhere from 2 to 5 families at a time, depending on the size of the families, and that's a fairly onerous activity as well. You need to organize, be quite creative in how you're going to structure the dynamics so that the children aren't touching one another, and they will also organize with the kitchen, because they'll sit there and have lunch with them also. So that takes up a lot of time. So at the moment they're doing that, and also working with the health department, and doing therapies when they can. But it's been difficult for them also because there are only so many hours in a day, and they've been doing a phenomenal job. It's a tough question. The government is working. They started well. They implemented very strict measures very quickly. I guess because they were very conscious of the fact that the health system wasn't prepared for something like this at all. But since then, I would say that they've struggled. I mentioned in the video conference that that corruption is a huge problem in the Honduran government, and we're seeing now that they're taking a lot of loans from other countries to try to deal with the problem, but they're purchasing materials at exorbitant prices. So you have to wonder whether there is some overpricing going on, and whose interest is that benefiting. They have also struggled in general because, like I mentioned, people live here. A lot of people live day by day and what they earned the previous day, and so access to food and you know, money and all of these things has been a huge and immediate impact, and the government has not been able to respond to really help that population. It's just too large. They claim they're you know, they have programs in certain neighborhoods and they're giving out provisions to people, and in some neighborhoods they are doing it, but in so many they aren't, and that's a huge problem. So people are starving. People are struggling with lack of access to very basic needs. Medications, etc., has been difficult for people. In Honduras, if you are a part of the population that live day by day and you don't earn what you would normally earn, whether it's $5 or $10 or whatever it is, you don't have anything for the next day, so you can't just stockpile your food. So the government are really struggling to have an adequate response to help those people. They have an unbelievably inadequate testing capability. Just recently they managed to secure 300,000 tests from through support from the US government. I believe 8,000 of those tests arrived the other day, but even that is nowhere near enough, and the fact that Honduras only has 700 cases now after a month and a half will tell you the lack of testing that's been done, because most other countries in the world have have confirmed cases in their thousands after a month and a half. And I don't believe that our numbers are so low, to be honest. And so that's challenging. They have a difficult time ahead. We have a difficult time ahead, and we'll have to see how they keep going and how this develops. Yeah, we do. The way we've got it set up at the moment. So Farid Morel, who is a hermano mayor himself, he grew up here in the ranch, studied psychology. He's now the coordinator of our community services department. One of his areas is the Hermanos Mayores program. For those of you who don't know, Hermanos Mayores refers to the people who grew up here in the ranch and are now out working or whatever the case may be. So Farid has been very busy calling all of the Hermanos Mayores that with whom he has contact. He has identified many of them who have required some support in some way or another. We've been able to secure provisions, food provisions for a lot of them, and just recently we received provisions from the government, which were bags of sort of what they call canasta básica here, which is kind of a bag of beans, rice, sugar, coffee, your kind of your basics. we had already bought those supplies anyway, and we had stockpiled them for a couple of months. So we decided to use that support from the government to support hermanas mayores in need. So we sent that to Tegucigalpa, where Farid has his office, and he started to phone all of those people that he knows are struggling, many single mothers or people who have lost their jobs. And thanks be to God, we've been able to help them through those provisions, and will continue to do so as much as possible.